Today we're going to talk about a healthcare provider. Now, just by saying that, you probably understand that that's someone who provides healthcare to you. But what does that really mean? Now, the reason that we're going to go into a lot of these things in depth is for two reasons. One, so that you can choose someone to give you the very best care, or someone in your family that needs the very best care. And the second is, perhaps, as you listen to some of these descriptions, maybe it might interest you into doing something in the healthcare field. Now, generally you go to a family practitioner, a doctor who supervises general medical care. This is called a PCP. That is a primary care physician. You go to a primary care physician to have an overall checkup, see if there's any problems, and then if there is additional problems that might be better taken care of by a specialist, then that PCP will usually refer you to that specialist. The specialist and the PCP work hand in hand very well. When the specialist sees you, they always send a report to the PCP, so he or her is kept abreast of what's happening in your care. Remember, if you're going to a doctor, you always want to choose a doctor that might accept your insurance plan, because it really can be an issue if you don't check into that first. Now, what kind of health care providers are there? You may be familiar with some of these, but we'll just go through it so you understand. An MD. What does an MD stand for? That is a medical doctor. If you see that MD after a person's name, it means they're a medical doctor. They went to an approved school of medicine and passed the required test to be able to practice medical care. They are trained in diagnosing and treating medical conditions. Now, you might see a doctor who has DO at the end of his or her name. That means a doctor of osteopathy. Still a medical doctor, has to take the same exams and pass all the same board reviews to practice in the medical field. But this is someone who specializes more in muscular and skeletal problems. You might also see that they look at things in a more holistic, natural way. Some medical doctors do as well now. PA, a physician's assistant. This is someone who greatly leverages a doctor's reach to the people primarily in rural areas where you don't have a medical doctor that's available, but you might have a physician's assistant. A physician's assistant is trained in being able to diagnose and even prescribe medications, but that person works under the jurisdiction and the license of that medical doctor. They report to them, discuss what the alternatives may be, and they work hand in hand very closely with that physician. You also might see a physician's assistant being able to assist in surgery with that particular doctor. Now, you might see someone that has an NP after their name. That is a nurse practitioner. That means it's a registered nurse, but an advanced practice nurse, meaning they went to more schooling, did a lot more things that allows them to specialize in care and be able to diagnose medical conditions and prescribe medications. Now, they have, most of the time, more leverage than a physician's assistant. They are still working under a doctor's license, but they have a lot more autonomy. They are in a clinic and they don't have to check in on every single thing they do, because within the scope of their practice, they are covered and they have that expertise to do that. Now, when you're looking at what doctor do I want, these are some things to consider, and they actually are important things to consider because they're going to really help you get the best care that you want. First of all, does this doctor accept my insurance? Where did this doctor go to school? What specialized training does this doctor have? Often, if I'm looking up a doctor, I look at the qualifications, and I'll see on some it says board certified. Now, to understand what board certified means, first of all, let's understand what it means to become a doctor. It means you need to have 4 years of formal training in college. Then with that 4-year degree, you get accepted into medical school, which gives you another 4 years. After you graduate from medical school, usually there's a 1-year internship where you do different rotations. Now, legally, you could go out and practice as a physician, but many physicians now also wish to have a residency, and some places require that residency. And a residency is 3 to 5 years after that person has obtained their medical director license. Oftentimes, if they wish to be board certified, they have to go through rigorous testing. They have to go through continuing education, and they go through peer reviews to make sure that they are, in fact, board certified and keep up with that type of accreditation. I also look, and you may want to, at the reviews and the ratings online. You need to be careful because often these are governed by people's opinions, but it sometimes gives you a good idea to know what kind of bedside manner perhaps this doctor had, or how people have felt about it. Again, you need to be careful of those, but it does give you some awareness. Now, when you go to see the doctor, you are not locked into a doctor. You get to ask yourself these questions. Did I feel comfortable with this doctor? Does this doctor feel like it suits my needs? Am I able to communicate well with this doctor? Is he or she listening to what is going on with me? Are their fees reasonable? Is their location convenient? Am I waiting a long time to even be able to make an appointment, or when I go there to be able to be seen? There's a lot of factors, but you are the consumer. You get to make the choices. So I hope this helps you in being able to be empowered in knowing how to choose the correct doctor.